Assalamualaikum warahmatullahi wabarakatuh, and a very good day I bid to Dr. Zamira. We are from Group 1 presenting the topic of diuretic agents for antihypertensive. Diuretic agents consist of thiazide and thiazide-like, loop diuretics, and potassium sparing. Thiazide and thiazide-like occurs at the distal convoluted tubules. Loop diuretics occur at the loop of Henle, and potassium sparing occur at the collecting duct.
Alright, so the first diuretics that are used to treat hypertension is loop diuretics. The two prototypical drugs that falls in this category is furosemide and ethacrinic acid. Loop diuretics inhibit the co-transport of sodium ion, potassium ion, and chloride ion at the ascending loop of Henle, thus decreases the reabsorption of sodium chloride. This makes it the most efficacious diuretics as ascending limb accounts for 25 to 30% of sodium chloride reabsorption. Thus, it is also sometimes called high-ceiling diuretics. Loop diuretics also induce expression of cyclooxygenase, which produces PGE2, a prostaglandin which also inhibits sodium chloride transport in the ascending loop of Henle. For its pharmacokinetics, loop diuretics are administered either orally or parenterally. They have a relatively brief duration of action, that is 2 to 4 hours, and are excreted in urine. Like some other diuretics drugs, loop diuretics are also used to treat hypertension and congestive heart failure due to its ability to increase urinal volume. Besides that, loop diuretics are also a drug of choice for reducing acute pulmonary edema as they gives a rapid and intense diuresis effect when given intravenously. As they also stimulate tubular calcium excretion, loop diuretics are also used to treat hypercalcemia. The usage of loop diuretics carries risk. The first concern are its ototoxicity, which is dose-dependent and is usually reversible. This is commonly seen when loop diuretics treatment is combined with aminoglycoside antibiotics. It also causes hyperuricemia as it blocks uric acid secretion in renal and biliary secretory system, thus precipitating attack of gout. Besides, sudden reduction in blood volume causes acute hypovolemia, while the increased sodium ion in collecting tubule results in increased tubular exchange of sodium ion for potassium ion, inducing hyperkalemia.
I'm going to talk about distal convoluted tubule diuretics, or can be known as thiazide and thiazide-like drugs. Thiazide will act as a diuretic by blocking the sodium and chloride ion transporter at the distal convoluted tubule. This is why it will inhibit the sodium chloride salt reabsorption. Besides, thiazide will also increase potassium and magnesium ion excretion. Other than that, thiazide will also decrease the calcium ion excretion, which will eventually cause hypercalcemia. For pharmacokinetics, thiazide is only effective for orally. In comparison with the loop diuretics, thiazide will take longer time to produce a stable reduction in the blood pressure. This is also why thiazide will be prescribed to the patient with mild hypertension, while loop diuretics will be prescribed to the patient with severe hypertension. For indication, thiazide is going to be prescribed to the patient with hypertension, edema, and hypercalciuria. For hypertension and edema, the function of thiazide is to reduce the blood volume to cure these two symptoms. As we know, thiazide is going to decrease the excretion of calcium ion. Hence, this will reduce or relieve the symptoms caused by the hypercalciuria. Calciuria will have a very high risk to form renal stone. By prescribing thiazide, we will reduce the formation of renal stone, which will relieve the pain of the patient during urination due to the renal stone formation. For most of the diuretic drugs, we know it will cause excessive excretion of the potassium ion, except for the potassium sparing drugs. Hence, potassium depletion will be the major side effects of these both drugs, which is thiazide and loop diuretics. We know that thiazide works as a diuretic by increase the excretion of sodium ion. Hence, our body will lose excessive sodium ion due to the effect of thiazide, right? Hence, hyponatremia will be one of the side effects for thiazide. Then, hyperuricemia will also be one of the side effects to thiazide. Hyperuricemia will then lead to the formation of gout, which is the coagulation or the accumulation of uric acid at the joint. Then, as we know, thiazide will be contraindicated with all those diabetes patients. It is because thiazide will also cause hyperglycemia in the patient. To encounter the problem arised by the potassium depletion, potassium-sparing drugs will be prescribed to the patient together with the thiazide to reduce the effects or the side effects of potassium depletion.
Okay, for the last agent used in diuresis is potassium-sparing diuretic, also known as collecting duct diuretic. Examples of this agent are amiloride, triamphetamine, spironolactone, ipreironone. This agent inhibits sodium-potassium adenosine triphosphatase ATPase in the collecting duct. This prevents the reabsorption of sodium in exchange for potassium and result in retention of potassium rather than sodium. So, sodium is eliminated in the urine along with its associated layer of hydration. Diuresis is produced. This most often is used in a combination with thiazide. Drugs are absorbed after oral administration and are significantly bound to plasma protein. Hypertension can be treated by this agent because diuretic cause sodium and water excretion in renal tubule to be increased, hence blood volume decrease, blood pressure decrease, and this can use to treat hypertension. Besides that, potassium-sparing diuretic also can use for heart failure. Aldosterone antagonists prevent remodeling that occur as compensation for progressive failure of the heart. Use of the drugs have been shown to decrease mortality associated with heart failure, particularly in those with reduced ejection fraction. For ascites, which means accumulation of fluid in the abdominal cavity as a common complication of hepatic cirrhosis, potassium-sparing diuretics is effective in this condition as it can excrete water from our body. The side effect for this agent, for example, spironolactone can cause gastric upset, hyperkalemia. Thus, it is very important to monitor potassium level when the drugs are given. Besides that, nausea, lethargy, and mental confusion can also occur.